Congratulations, Madam First Lady, first of all, on your award. You've been so involved as a critical GAVI partner. Tell me first, what is the importance of vaccinations and immunizations in the world?
You know, it's so funny because immunization is just the greatest success stories in modern world, more so in the developing countries. And one of the things that has not really been said, coming from a perspective of physician, is the fact that immunization has allowed many more young doctors getting into the field of pediatrics, child health. And I say so because I really enjoyed practicing pediatrics, but you know, the workload there in those days was just too much. Every 4 out of 5 admissions was infectious diseases. You know, we had measles, we had tetanus, and it was really so much that, you know, one ran away from the field of pediatrics. And it's not always nice as well to be breaking down bad news to families. You know, you go back home feeling like you have failed as a doctor. But now that has changed. You know, so many lives have been saved. We're now seeing few and fewer cases of measles, fewer cases of diphtheria, fewer cases of tetanus on the ward, and it's just made practicing so much better.
What about cervical cancer?
Oh, cervical cancer, you know, that's something I know that, you know, is very close to me. And I'm really looking forward to making sure that the developing countries have access to the HPV vaccine. You know, immunizations of vaccines are given on the premise that you want to prevent disease before it starts off. You want to prevent disabilities. You want to prevent suffering, and in some cases, death. And when you look at the cancer burden in developing countries, really, the African, especially in Africa, Africa cannot withstand a cancer epidemic and stay on course to be able to provide what is expected of you know, the governments in terms of housing, sanitation, and health. So we really have to make sure that we do something. And this is why I'm so happy that GAVI has invested, you know, so much in the provision of HPV vaccine, which is going to really shift that burden of cancer deaths away from the developing countries and perhaps even put it on par with the developed countries.
What else do African countries like Zambia, need to do to prepare?
I think we really need to start thinking in terms of policy shifting and really making sure that the field is conducive. We need to put in a lot of organization and infrastructure infrastructure provision, because we don't want to sort of start putting HPV vaccine you know, without being a comprehensive approach. So we need to make sure that as we give HPV, not everyone is going to have access to HPV. We need to make sure that screening services are available. We need to make sure that treatment services are available, and we strengthen the health system. And on top of that, I think we need also to have a robust epidemiological tool, which is going to be able to capture the data and be able to demonstrate that we are winning and we are making quite a huge difference in the countries that we are.
And finally, as you're a medical practitioner, as a woman, when you see the faces in front of you of people that suffer and the changes in their lives, how does it affect you?
It's really terrible. As I said, you know, one becomes a doctor because you want to save lives. And cancer has been one of those things in the past where you really felt helpless, hopeless. You see the despair in patients' eyes, you see the suffering, you see the pain, and you see people dying painfully. There's nothing as catastrophic to a medical practitioner as losing a patient. But, you know, in developing countries, you know that access to screening is a problem, access to treatment was a problem. In Zambia, we used to refer patients for radiotherapy outside at great cost.
Right.
But we're lucky because now we have a radiotherapy center, but it's still not enough because the demand is huge. You know, I wish sometimes, you know, every time when I dealt with cancer patients, I always wish that I had done something else. But now it's so changing because, you know, people's attitudes are changing, palliation is getting center stage, and somehow we started now realizing that there's more we can do to prevent people reaching that stage, and we're looking forward to the HPV because definitely the next generation is not going to be able to reach that stage.
Thank you, Madam First Lady. Keep up the great work.
Thank you very much.
Let's talk for a moment here to Dag. What more needs to be done for children, for women?
What we are about to do now, we need to do more of. We need to roll out new vaccines against diarrhea and pneumococcal to all the countries in need, and thus we'll save millions of children's lives. Unnecessary deaths, totally unfair because we have the means. Then we need to strengthen the health systems to go for those bottlenecks that prevent the vaccines to get out to the hard-to-reach areas and the hard-to-reach children.
What is it that GAVI needs most from people that may not have heard of your organization before?
We need the good spirit of all the health workers and all the leaders around the world to really take seriously the fact that all these children die totally unnecessarily. We need focus of civil society who can help us reach the hard-to-reach areas and who can help us advocate and keep up the consciousness of leaders around the world.
Thank you, Dag. Let's talk to Seth as well. Seth, what are the next steps that GAVI and its partners in this alliance need to take?
Well, we're coming out of this Partners Forum, hopefully, with a renewed sense of passion for the incredible work that everyone's doing. And it is about everybody doing it. It's about the political leaders providing the resources and making sure that there's interconnectedness among the sessions. There's also the CSOs who are advocating for what we need. There's the vaccine manufacturers who are producing enough vaccine for the amazing demand we've seen. And there's ultimately those healthcare workers who are out there in the village making sure people get them. All of that has to come together.
For someone who has not heard of GAVI before, of the great work that you're doing, what would be the message that you would want to send?
I think the most important message of GAVI is we have these incredible tools that we expect every one of our children in wealthy countries to get. What we want to make sure is that every child everywhere has access to them. It's as simple as that. It can be done. We did it with smallpox. We're doing it with polio. Today there are 11 vaccines. If we can get those to every child everywhere, we can make a dramatic difference in the health and happiness of the world.
Seth, thank you so much.
Thank you.
With the GAVI partners here in Dar es Salaam, I'm Zain Verjee.